Hi, this is Dr. Bueller, and we're going to talk about the third part of our RNA viruses section, which is going to be hepatitis C and the virus HCV. So there are a lot of reasons that you can have hepatitis. Hepatitis really just means liver disease, and there are a lot of drugs that can cause hepatitis. Alcohol use can cause hepatitis, and certain viruses that attack the liver itself can cause hepatitis. So Hep C is the major virus that causes viral liver disease, and it can produce an acute infection that just feels like any general viral infection where you have muscle pains, fever, fatigue, and then 15 or 20% of the population that gets it is going to fight it off successfully and clear it completely. No problem. However, a large percentage of people that are infected are not going to clear it. The virus doesn't go latent. It doesn't hide in the cells, inactive, but it does slow down. So it has an active chronic infection that's just slow replication. So the hepatitis that people get from Hep C is usually very slow and progressive over years. About 50 to 85% of people infected are going to get this progressive liver disease. 15 to 30% of the people infected are going to get some cirrhosis, and 1 to 5% of people infected could die of liver failure. There's also the risk of liver cancer and that mortalities. Because the chronic infection is very slow and doesn't affect a lot of organs, a lot of people who have this chronic infection are unaware of it. We also, unfortunately, don't have a vaccination for it, and so if people aren't tested, they're not going to know they need to get treatment. Again, viral hepatitis is going to lead to long-term liver damage and liver cancer in some people. And when we talk about hepatitis B, we're going to talk about high infectivity. Hepatitis C is less infectious and is usually gotten from bloodborne or sexual activity. So one really important thing to know about hepatitis C right now is it has a very high frequency in people who are born from 1945 to 1965. And those are those post-World War II babies, otherwise known as baby boomers. So 3 in 4 people that have hepatitis are boomers. And again, most of them don't know they're infected. So it's really recommended that people who are in that age range go ahead and get tested. Hep C is an RNA virus. And as we said, once infected, the body has that normal acute infection response where you just feel kind of generally sick, and many people will clear it. A larger number of people won't clear it and will have that low-grade chronic infection. Again, that chronic infection is active. It's just really low and slow. So we can't call it latent. Latent has to do with a viral infection where the virus is inside the cells and stops replicating, and then can come back later and replicate when the immune system is low, like chickenpox. So because that is an active infection and it's going on for years, that is going to lead to progressive liver damage. And this is the most fatal of the hepatitis viruses. There's unfortunately no vaccine. And again, I mentioned that the main transmission, it's actually kind of hard to get. It's not aerosolized. It's not gotten through the respiratory system or by eating. It really has to be transmitted by bloodborne activities such as IV drug use, transplants, needle sticks, and right now there's a surge in hepatitis C from getting piercings and tattoos from non-licensed non-professionals. It is definitely transmitted by sexual contact, but if the mucous membranes in the genitals are healthy, there's a fairly low risk that the virus is going to be able to access the bloodstream. If there's micro tears, such as sexual contact without appropriate lubrication, or if there's sores present, such as having other types of STDs, then the risk is much higher. So we're going to have only 3 major drug classes with 2 subclasses within one of them. And they're all going to be targeted within this major complex of replication. So we don't have entry inhibitors, we don't have exit inhibitors, but the major enzymes within the Hep C virus are all kind of stuck together in a complex that's on the endoplasmic reticulum. So we have a protease, we have a more structural replication complex, and we have the RNA polymerase. And these are very commonly referred to by their numerical names. So we have inhibitors for protease, we have inhibitors for the replication complex, and we have two different types of RNA Pol inhibitors, both nucleoside or nucleotide analogs and non-nucleotide analogs. We also have several different combination drugs, and these are the three you're going to be responsible for. So a very quick introduction to the viral structure. This is, again, an RNA virus. So the genetic information inside of it is in the form of a single-stranded RNA. It has a capsid, a membrane envelope, and membrane proteins. There are two membrane proteins that we're interested in, the E1 and the E2 envelope proteins. What's really unique about the HCV virus is it's associated with a lipid droplet. And that lipid droplet is actually lipids from our cells, and we use these naturally to transport lipids and cholesterols through the bloodstream. So the virus has managed to kind of grab onto that lipid droplet and uses that to be safely transported through the body. It also uses that internally during replication as that lipid droplet helps guide it through the endoplasmic reticulum and through all of its processing. And this is just an indication of the single-stranded RNA, and you don't need to know those specific proteins or coding. So you're going to have a video on the next slide, but like always, we're going to preview it so that you know what you're looking for. We start with the HCV being that lipid-coated virus, so it has that LDL-like lipid droplet. And that includes APOs, and you might remember ApoE as being part of a lipid droplet that's involved in clearing beta amyloid from amyloid plaques in Alzheimer's disease. So the virus itself has these E1 and E2 envelope proteins that are going to bind to host cell enzymes and proteins. And while a lot of the viruses, we have only one or two host proteins that we're going to talk about, there are at least 6-7 host cell proteins that are going to function in the binding of the HCV. So we're not going to go into the specific proteins. So after it's bound, the virus is going to be endocytosed, and it's going to have pH-dependent fusion with a vesicular membrane and uncoating, where the viral RNA is inserted into the host cell. In the case of HCV, actually, it is not also coming with the RNA Pol. That's going to be made later. So like all viruses, the host cell is going to use its ribosomes. It's going to use the viral RNA, in this case, to make viral enzymes, other viral proteins, and then using the viral RNA Pol that the cell has just made, also going to replicate the viral nucleic acids. In addition to these structural proteins and new nucleic acids, the cell makes a viral protease that's used to specifically clip the viral polypeptides. HCV is very interesting in that all three of these are kind of clumped together on an endoplasmic reticular membrane where they're all attached to each other. So you've got a viral protease subunit, structural and functional proteins involved in what we call a replication complex, and then your RNA-dependent RNA polymerase, all attached to each other and right next to each other. After the viral proteins are produced and the viral RNA replicated, then new virions can be assembled. That assembly goes through the endoplasmic reticulum, and there are multiple steps for that. One very important step is that a lot of these viral proteins have glucosides on them, and those glucosides have to be clipped away using a viral glucosidase. The virus also uses this lipid droplet in order to help guide it through the endoplasmic reticulum, buds with that droplet, and then has that droplet as it's circulating through the bloodstream. So now please go ahead and watch this video. And as usual, I've given you a diagram of the life cycle, not for you to memorize this particular diagram, but for you to have something that you're drawing on as you go through the video. And because this video is extremely complex, I want you to focus on those steps that we talked about in the prior slide. So of those steps that you just saw in the video, we have as current drug targets the viral attachment and docking stages, the endocytosis, the fusion and uncoating stages, and like some other RNA viruses, a virally specific enzyme for purine synthesis. We're also looking for targets about assembly and budding, and hopefully you'll be seeing some agents come out for that. We have some alpha glucosidase inhibitors that are involved in getting those proteins ready for assembly. What we do have drugs for is that RNA transcription, which can be either for purposes of mRNA and protein replication and protein production, or in order to have that RNA for replication for new viruses. And as I said, that includes a replication complex that had those NS5A subunits, which you see right here. We also have drugs that are going to act at that viral RNA to RNA polymerase, which was right here. And we have drugs that act at that particular viral protease, which is right here. So the drugs that we use that are actual antivirals for hepatitis are called direct-acting antivirals. And that's really to separate them from other drugs that might be targeted to reduce the liver damage in other ways. So that first class was the protease inhibitor, NS3-4A, and there are several of those. The one that you guys are going to need to know now is glycoprovir. And its mechanism of action is that it's inhibiting the HCV-specific viral protease, and by doing so, it's going to block protein processing. Now, as I say that these things are inhibiting the viral protease, viral pol, we're really meaning the HCV-specific form, because remember, all viruses are going to have somewhat different forms of these proteins and enzymes, even though they're all related. And so, say, a protease inhibitor for HIV is not going to be exactly the same as a protease inhibitor for Hep C or one for coronaviruses. So when you talk about and think about antiviral protease inhibitors, antiviral RNA or DNA pol inhibitors, you can't lump all of them together. You have to think of them in terms of which virus they're focused on. When we talk about adverse effects for these direct-acting antivirals, these agents are never used alone. They're only used in combination. So really, we don't talk about the adverse effects of single drugs. We're going to talk about the adverse effects of the combinations in their entirety. And we're going to do that at the very end of the lecture. So the drugs that are acting at the replication complex, NS5A, include ledipasvir, pibrentasvir, filpatasvir, and several other that we're not going to be memorizing right now. Declenza might be one that's going to become more important that you may end up needing to know about soon, as it's being marketed as a pill a day for 12 weeks to completely eradicate the virus. So the mechanism of action, it's going to inhibit that replication complex protein, the NS5A. Exactly how it's doing that, we don't know. But one of the most interesting things you can look at, the structure, is that both sides of it are exactly the same. And so it's going to be able to sit in here right where those two subunits of the SN5A dimer are occurring. So because it's blocking that replication complex, which is necessary to produce new viral RNA, you're not going to actually be able to produce mRNA, so no proteins, and you're not going to be able to produce additional RNA for new viruses. So you're really going to be able to block both replication and protein production. The last two classes of the direct-acting antivirals are both going to be RNA to RNA pol inhibitors specific to Hep C RNA pol. And if you remember, RNA-dependent RNA pols mean that they use RNA as their template and then produce an mRNA as the resulting product. So we mentioned that there are two types of RNA pol inhibitors for Hep C. We have nucleoside analogs, and then we have non-nucleoside analogs. And when you learn about HIV, you'll see that we have very similar drug classes, but specifically focused on the reverse transcriptase polymerase that you find in HIV. So the drug names here, sofosbuvir or Sovaldi, and ribavirin or Rebitol, are both analogs to nucleosides. And since they look very much like a nucleoside, if you take the template RNA here and put your polymerase here, as it is adding new nucleosides as it goes, if you have an analog that chain terminates and that it doesn't allow a new nucleoside to be added, then you're just going to stall that whole process. And you're not going to be able to allow any further RNA production. So these are analogs because they look like nucleosides, and they bind into the RNA polymerase and stall it, blocking viral replication. You may notice that ribavirin has several warnings. It can actually be a pretty dangerous drug. It's a category X, which is a very high category for warning of use in pregnancy. It has actually been found in humans to be able to cause birth defects or death of an unborn baby. It's also not to be used alone. It has to be used only in combination with other hepatitis C drugs. and it can be toxic to red blood cells. This can actually lead to myocardial infarction, and so anyone with a history of heart disease shouldn't be taking it. So remember, ribavirin has 3 black box warnings and is a pretty serious drug. The last of the direct-acting antivirals are also RNA Pol inhibitors, but these are the non-nucleosides. So they do not look like a nucleoside, they're not analogs. Dacarbazine, or Exviera, simply binds to that NS5B, and the exact site of binding has been unsure, but it's going to inhibit the activity of that enzyme. So it's that viral RNA polymerase. You have to really remember it's a non-nuc, it's not an analog, but it's going to block the replication of the RNA and therefore block viral replication. So the last drugs you need to know about are those combos, and it's really important to know the names of the combos because that really is how they're given. Mavorette, Epclusa, and Harvoni are some of the main combinations right now. For these particular drugs, you're not going to need to memorize the constituents within that specific combo, but you do need to recognize that the combo is a combo for treating HCV. And if I give you the drugs inside, you need to tell me which drug class those particular agents are and how they're treating HCV. Here you'll notice that this says pangenomic, so that means that these 2 combos are going to be effective against multiple strains of Hep C, whereas Harvoni is more limited. To really get rid of Hep C, patients need to be treated for quite a long time. Most of the treatments last for 12 weeks, and for a 12-week treatment, it costs from $30,000 to $100,000. That new Mavorette only takes 8 weeks, but it's still quite expensive. So the adverse effects of the combination drugs are going to be fatigue and weakness, headache, nausea and diarrhea, insomnia, and sometimes skin reactions, in which the skin can be dry or you can get a sun-induced rash. So to review those classes of direct-acting antivirals, we've got those nucleoside-nucleotide analogs that are RNA Pol inhibitors, and you specifically need to know details about ribavirin. You've got the non-nucleoside-nucleotide analogs, the replication complex inhibitors, the protease inhibitors, and these 3 particular combination drugs. And here I'm really specifying not to mix them up with HIV drugs, because we have nukes, non-nukes, and protease inhibitor HIV drugs that are specific only to HIV. A little bit of a naming hint, the protease inhibitors are Previrs, P for protease. The RNA replication are Acivirs, and both of the types of RNA Pol inhibitors are Buvirs. So when you've gone through all of your antiviral lectures, you can come back and you can review and contrast the different types of hepatitis, which will be extremely helpful because they're often confused with each other. All right, thanks for sticking with us for RNA viruses, and the next lectures will talk about retroviruses, specifically HIV.